Hey everyone, today we're going to look at ankle inversion sprain, also known as lateral ligament injury. Now when I use the word ligament, these are structures which cross the joint from one bone to another bone. So what they primarily the function is to prevent any unwanted, unnecessary excess movement of a particular joint. Now sometimes with sports or any other everyday activities, if you happen to cause too much of movement, these ligaments can sometimes they get injured. Now that's why they use the word sprain. Now today the focus is ankle. Now in sports this is very common, especially with the ankle allowing a certain movements to happen more than the other movements. Okay, now let's just focus really quick at the ankle for the movements. All right, now if you take a look here, now your ankle you are able to do certain movements like dorsiflexion, plantar flexion. Then you got adduction, abduction, then you got inversion and eversion. So these are the possible movements which can happen in the ankle. Now, especially on the lateral side of the ankle, when I say lateral side, the outside of the ankle, you got some certain ligaments running on the side, preventing certain movements. For example, the ligaments on the outside of the ankle, they are designed to prevent too much of these movements. Now the first movement is too much of plantar flexion, too much of adduction, and too much of inversion. Now a combination of these three movements, when it happens in excess, is when you damage these ligaments. Very common if you happen to go like that during sports, even if you're walking on high heels, if you trip, if your ankle goes and buckles this way, usually what happens is these ligaments can get injured. Now with ligaments lack blood supply. That's why they're pretty much white in color. So when they are injured, the healing is not 100%. You're never going to get the full strength of the integrity of the ligaments back again. So what's a primary goal of treating ligament injuries? Now when you damage ligaments, you probably make it about 60 or maybe 70% of the strength back. Also depends on many factors like age, your lifestyle. Say if you're a smoker, it's going to be a little less than someone who doesn't smoke. So there are many factors. Age is a huge factor. The younger you are, the more percentage of strength you're going to get back. Now let's take for an example. Someone damaged the ligaments, they're probably going to get about 70% of the strength back on the lateral side. So what are we going to do about the lost 30%? Now that's when we target the muscles around the same area. Now for example, if you look at the ankle one more time, now you got a lot of muscles running from here to here around the same area where these ligaments are. These muscles are on the outside of the legs. They're called peroneus longus, peroneus brevis, and peroneus tertius. These muscles, they cause a movement called eversion. So they do the opposite of what the injury happened. Your injury took your ankle inside, but these muscles move your ankle outside. Now let's think about it. If you strengthen these muscles, what these muscles are going to do is they're going to have more integrity of the outside of your ankle to compensate for the lost 30% lost strength because of the ligament injury. So the ligaments will get back some strength and the muscles will add more strength. So what happens is you are preventing these ankles from further moving in and causing further injuries on a repeated fashion. So that's the whole idea of doing these ones. All right. Now, how do we strengthen these muscles on the outside? You got a couple of ways to do this. Obviously, the easiest way you can use is by using these elastic bands. Now, these are stretchy bands. They come with different colors. Different colors means different resistance level. Some companies have the yellow as the least resistance, to green and blue to black as a higher resistance grade. So it's always advisable to start with a lower color, lower resistance, and slowly progress as according to your levels of pain. Now these exercises can only be done at a later stage of rehab. You don't want to be doing this the very first or second day after an injury because you'll be putting a lot of stress on that area. Make sure all the inflammation is down, the pain is all gone, you're able to walk well, and that's when you have to start strengthening these muscles around. Okay, now the one way of doing this is if you have a band which is not a loop, so you can just tie the band on one corner and then you can make a loop like that. Or some bands, they come with a loop, which is more easier to use. Now, here's how you strengthen if you just want to target one ankle, all right? Now, I'm just going to bring that video down a little bit so you all can see how I do this. So make sure you wrap this band around both the feet, as you can see, assuming this side is the affected side and you strengthen. And what I would do is make sure the band is not too much on the outside or too much on the inside, right around wrapping around that little pinky there. Now, to add a little resistance, just assume this is the good leg. Just take that a little far away, so produce some tension right there. And then what I'm going to do is I'm going to scoop my feet out and up. Now that's the action. Now this is the opposite of how the injury happened. The injury took my ankle in. Now I'm going to go bring it out and up and bring it back in. Notice my heels are planted on the foot. Do not move your heels. It is just the forefoot, the front goes out and up, as if you're scooping an ice cream up and sideways. So sideways and up. One more time. And up. And you're going to bring it back slowly to a central position. Don't try to take it in. You don't want to be doing that movement which caused the injury. Just bring it up to a neutral straight position and then repeat again and bring it back again. Try to aim for about 15 repetitions. So every time you go out and in, that's considered one repetition. Again, the movement should be done nice and slow and smooth. So no jerky movements, and don't do it fast. So it should be like very slow and gradual and come back into the center. Again, gradual up and down. Now, the movement I'm performing is called eversion, which is the opposite of inversion. So when you perform eversion, you're targeting all the muscles of the sides here, strengthening these muscles, which will add more integrity and help the ligaments to prevent any further injury. So once again, put the band all the way up and bring it down. Now, another way of doing that. All right, here's another position where you wrap the band around the feet just like how you're in a seated position. But this time, we are planning to strengthen both sides at the same time. So once again, remember to keep it a little bit stretched out on both sides. And then whenever you're ready, you're doing the same scooping movement out and in. Once again, scoop out and scoop back. And now we're targeting both ankle at the same time. Now this is a good practice where you're also strengthening the other ankle to make sure that preventing any injuries from happening further. So this is how you strengthen both sides. Nice and slow, and slowly bring it back. Okay, once again, aim for 15 repetitions and give some rest, and then try to repeat that one more time. That would be like 2 sets, but also aim for 3 sets if possible.